Members, 2024 has been a busy year here at the Nurses and Midwives Association. We're heading into the festive season with record member growth. More than 80,000 nurses, midwives and carers are now standing side by side in the shared fight for better paying conditions. This strength in numbers has translated into some of the most committed activism we've seen in our union's history. In the public sector, our ongoing campaign for better pay has seen record turnouts at rallies and political actions across the state.
In early September, we saw around 3,000 members take their message to the electoral office doorstep of Premier Chris Minns. Just weeks later, more than 10,000 nurses and midwives came together to march on State Parliament, the largest rally of its kind here at the Association. And then last month, after the government continued to take us for granted and once again failed to negotiate in good faith, more than 11,000 members took action across the state to remind the government that we will not be silenced. Members, we know parliamentarians are feeling the pressure. Many federal Labor MPs and state crossbenchers have come out publicly to support your campaign. In the past few months, we've seen members, their friends and family and your supporters in the public all get behind our community and political lobbying.
To date, almost 10,000 letters have been sent to MPs across New South Wales, urging them to back our fight for better pay. 500 calls have also been made to local politicians, and we know many of you have met your MP to discuss the concerns in person. This has been a huge undertaking, but we know that it's only possible because of your dogged commitment, and for that we thank you. We know that the implementation of ratios in this state is only possible if the public sector receives a proper wage increase. That is one that brings nurses and midwives in line with their interstate counterparts. We'll be championing this message in 2025, and we're ready for the next stage of this fight.
Nurses and midwives working at major private hospitals are feeling the same pressures and have been flexing their muscle in the ongoing fight for fair pay and improvements to conditions, including ratios. We've never seen this level of action from the private sector. It's truly inspiring to see such strong and determined members fighting for what they deserve. Members employed by Ramsay and Healthscope proved they're not to be taken for granted. Hitting the streets for strike action demand management meet them on their respective asks. Despite methods of intimidation, members have stuck together and stood their ground. It's a testament to their determination that we are seeing so many members united to fight for their rights at work.
We're proud of the changes we're seeing in the aged care sector after decades of neglect. As part of our ongoing reform agenda with other unions, we've seen wage increases delivered through the aged care work value case, and aged care residents are now receiving safer, more personalised care thanks to the implementation of minimum care minutes. This is real progress, but there is still more work to do in 2025 to hold providers to account. Throughout October, the Association visited more than 110 aged care facilities across the state. We held conversations with frontline aged care workers and identified almost 80 members who were willing to put their hands up to take on a more active role on improving conditions in their workplace. Importantly, we also saw more than 210 aged care workers join the association as a result of this work. Over the past 4 years, we've seen more than 11% growth in members working in the aged care sector. This is a terrific outcome, and it means we'll have an even louder voice in campaigning for future improvements to paying conditions for aged care. Last month, we held our first primary healthcare symposium. This was an important opportunity for members employed in areas such as medical centres and GP services, telehealth, community care, IVF clinics, just to name a few. They came together and they discussed the issues that matter to their area of specialty. It's great to see enthusiasm building in this sector, and we're committed to securing improvements for primary care nurses and midwives. This includes the new work value case that's seeking a 30% pay increase for all employed nurses and midwives under the Nurses Award 2020.
In May, we welcomed news of a new support payment for student nurses and midwives undertaking clinical placement training. This is hard-fought for reform that your union has campaigned for. It will see the next generation of nurses and midwives offered greater support during their mandatory clinical and professional training periods. We know more must be done to eradicate placement poverty, but this first step is a welcome one. We recognise the challenges of housing affordability too, And the association is proud member of Housing Now, an alliance of community groups and unions advocating for solutions to address the housing crisis in this state. We also partnered with Third Eye, whose development proposal has seen the handing over in perpetuity of housing for healthcare workers in Crow's Nest, a model that proves when we get the planning right, we can deliver essential worker housing close to where people work. There's plenty of work to be done, and our advocacy will continue in 2025.
In addition, we continue to back the Gomeroi people in their fight against the Santos Narrabri gas project. We recognise that nurses, midwives and carers have an important role in tackling climate change. Failing to do so will mean poorer health outcomes for our communities. In June, our members were recognised for the role they've played in the Gomeroi campaign, receiving the Jack Mundy Award for the union's contributions to the conservation movement.
As 2024 comes to a close, please take a moment to reflect on the great examples of solidarity we've seen this year. Thank you for your support and collective fight. We look forward to ramping up our fight for better pay and conditions across all sectors of health in 2025.
Thank you for your hard work in 2024.
Merry Christmas!